Super. Okay, hey, this is Adam Mayberry. I'm the lead PIO for the Joint Information Center for the incident management team that's responding to the COVID-19 pandemic here in Washoe County. Good Friday morning to everybody. Appreciate you being here. This is our attempt again to do these 3 times a week, Monday, Wednesday, Fridays, 11:30 for about 30 minutes, have some subject experts, opportunity for our media partners to answer some questions, get some questions answered. I do have a few quick announcements I want to make. First of all, these are being recorded. We want to put them on our YouTube, the respective city and county YouTube and social media platforms, so the public and you can watch them. So I've had a few reporters ask me if these venues are on the record. Of course they're on the record. That's why we're doing it. Also, later today at 1 o'clock, we'll have our first virtual town hall series. We'll have both mayors, the county chair. We'll also have subject experts from each hospital, as well as REMSA and other health-related topics. The questions have been submitted in advance. That'll be 1 o'clock today. You can view that on the YouTube channels for the city of Reno, Washoe County, and the Facebook page for the city of Sparks. Again, that'll be today, and we'll continue that series again next Friday at 1 o'clock and the following Friday, 1 o'clock. I believe we're planning on 3 of those. Also for our media partners, on Monday, we're inviting you to tour a mock COVID-19 sample collection at the Reno Livestock Event Center for COVID testing. That'll start at roughly 12:45. So we'll be getting some information out on that. There's been a lot of questions about what goes on, and for privacy reasons, we haven't been able to really demonstrate that. But we'd like to provide a kind of a mock demonstration for you. So that'll happen on Monday, this coming Monday. I think that's the 13th, about 12:45. So those are some of the statements that I have. We do have a subject matter expert. I'm pleased to introduce Dr. Jenny Wilson is with us. Dr. Wilson is a medical director at REMSA. And medical director for the Reno Emergency Physicians Association, which is the contracted emergency physician group for St. Mary's Regional Medical Center. Has a very impressive resume, including graduating from Johns Hopkins University School of Medicine. Your Joint Information Center thought it would be appropriate to have a subject matter to help you understand outlying symptoms, if you will, or outlying conditions, rather. If you know, we've had 10 COVID-related deaths in Washoe County, all with underlying conditions. So I thought it would be helpful to kind of get a better understanding of what that means and other symptoms and that are applicable to COVID-19. So Dr. Wilson, appreciate you tuning in and giving us a few minutes of your time. She'll provide some remarks and have our media partners have the opportunity to ask her some questions. So thank you, Dr. Wilson.
Thank you, Adam, and thank you guys for having me here in this interesting format I haven't done before, other than a bunch of times this week on Zoom. I know there's some questions about the underlying conditions that might portend a worse prognosis for patients who are infected with the novel coronavirus and develop COVID-19. This is really very I'm really generalizing saying this, and I'm happy, obviously, to take questions after this. But the thought is that many underlying conditions, such as obesity and hypertension, chronic lung disease, and coronary artery disease, that they have a baseline, people with those conditions have a baseline elevated inflammatory state. And whenever anyone gets infected with any kind of organism, including the novel coronavirus, that leads to inflammation itself, even in a perfectly healthy person. The thought is, one theory is that their baseline inflammation leads to an excess, over-exaggerated inflammatory reaction when these people with these underlying conditions get infected with COVID-19. And the inflammation, the roaring inflammation, as it has been described, is responsible for a lot of the ill effects of having the disease, in particular the acute respiratory distress syndrome, ARDS. I can make other comments or I can take questions. Up to you guys.
This is Ann Jeanette Damon with the Reno Gazette-Journal. I do have a question that I would is not directly related to an underlying condition, but I wonder if you might have some expertise on. I'm working on a story about some healthcare workers who are given advice by their employer to use their mask for 2 days, but on the second day to turn it inside out and put that outside version up against their face and wear the mask inside out. Is that safe guidance?
So a couple of questions about your question. Are you referring to healthcare workers or are you referring to the general public?
Healthcare workers specifically that work hands-on with patients.
Probably the most important thing that I should say about this is you get into dangerous waters talking about other people's PPE. I call it OPPPE, because the various hospitals have different policies. There's some hospitals that only use what's called a PAPR, powered air purifying respirator. They will use those when they come into a situation, when their healthcare staff come into a situation where there's an aerosolizing procedure, and they don't necessarily use N95s. There's other, even the policies within my own hospital have developed according to a lot of things. So I wouldn't be able to answer whether or not wearing a mask one way and then turning it inside out 2 days later would be advisable. My personal hunch is, well, I don't even think N95s can be turned inside out. That is definitely not a recommendation that we are following. Like I said, it's obviously, I'm sure everybody on this call knows, it's a really complex issue. What degree of personal protective equipment is adequate for each situation? They have said, so they used to distinguish patients between aerosolizing procedure and non-aerosolizing procedure. So like intubation would be an aerosolizing procedure where a lot of the virus is getting coughed up and coughed out and filling the room. And that would obviously require the utmost protection. But if I go into a patient's room and they don't feel like wearing the surgical mask we've given them, and they take it off and then they, cough a couple of times, then that's kind of an aerosolizing procedure in itself. So to draw clear lines and say, this is adequate, this is not adequate, this is good for reuse, this is not good for reuse. It's really, I don't think that there's probably a consensus somewhere, but I would take whoever's telling you about that recommendation and have them talk to their, administrator or their boss to see where the logic comes from. Is it the CDC or is it just an institutional policy? I hope that sort of answers your question by not answering your question.
Yeah, I understand. It's a lot. These are just the surgical masks. And from what I read on CDC guidelines, and I'm not a doctor, but you're not supposed to touch or have that outside surface of the mask touch any other surface. So when you store it, if you have to reuse it, you're supposed to fold it inside out so that outside surface, not inside out, you fold it in half so it doesn't come into contact with your storage procedure. So then it just doesn't seem to make sense to me that you would then put that outside surface up against your face.
I would agree with that, but that again is me personally agreeing. At some point, the viral particles desiccate, they dehydrate when they are on fabric or material, like such as a surgical mask. So I suppose if you took that mask off and left it for 72 hours in a paper bag, that might work, but please don't mistake this for an actual recommendation. But my instinct is the same as yours.
Thank you.
Adam, you're muted.
Yes, I sure am muting. Thank you. Can you maybe talk a little bit more about what some of the underlying conditions are, some of the other underlying conditions are that are out there? And also, can you address if you're not symptomatic, but you could still have COVID, and how that that situation kind of fits into this crisis that we're experiencing.
Okay, the second part of your question was being asymptomatic and actually having it. Is that what you're saying?
Yeah. So
What was the
two
second
questions I want you to address. If
So
you could-
underlying conditions, so the most common underlying conditions, I believe, are hypertension and obesity. In people less than 65 years old, it's the most prevalent underlying condition is obesity, and greater than 65 years old, it is hypertension. There was a study recently put out that had almost 1,500 patients, and it comprised 14 states. It was referring to patients who were admitted for COVID-19 or its complications between March 21st and 28th. And of those 1,482 patients, 90% of them had an underlying, had one or more underlying health conditions. And I believe 75% of them were 50 years or older. So the underlying health conditions are, the most common ones are coronary artery disease, diabetes, chronic lung disease, obesity. I'm not actually saying these in any order. Renal disease is also a factor. So if you have those, I mean, my recommendation is to everybody to please stay home unless your job requires that you leave the house. And all this discussion about the underlying conditions, it won't matter if you don't get it. So, I mean, I kind of want to back up from a discussion of underlying conditions to say, if you stay home, and if the people you're staying home with stay home, also, there's a very low chance that you're going to get it. You have to touch your eyes or nose or mouth with the virus, or have somebody cough in your face, which I think these days, I don't think anyone's letting that happen. So if you have good hand hygiene and you stay at home, and clean surfaces a lot, and have somebody younger and perhaps healthier than you go to the grocery store for you, I think there's a low chance that you're going to get it. And even if you do have one of or more of these underlying conditions, that does not mean that if you get it, that it is doomsday. The majority of people, I know all know this, the majority of people who get this disease will not have to seek medical care, certainly not in a hospital, will not be ventilated, will not die. So it's okay. I don't want people to panic. I want them to panic just enough to stay home, but I don't want people to truly panic. If you practice good hand hygiene, it's going to be hard to get the virus.
Thank you.
Oh, and then asymptomatic transmission. Yeah. I would not necessarily say that I'm an expert on this.
Okay.
I probably watched as much news as you guys have, but yes, you can transmit the virus before you know that you have it, before you have any symptoms. And again, I'm going to sound like a broken record, but so if you stay home and you're asymptomatic and you have it, you're not going to transmit it. You may transmit it to other family members, but you won't transmit it outside in the community. And if the virus attacks one person and they have a mild course and they stay in their house and the virus goes away, runs its course in that person, it can't infect anyone else. If that person goes to spring break on the beaches of Florida and gives it to 3 friends, they'll each give it to 3 friends, and so on and so on. You've seen the graph. So asymptomatic transmission is alarming, and I think that's probably part of what's behind the recommendation by Dr. Fauci for people to wear masks in public. So if you do cough, even if you feel kind of fine, but you have a little bit of a cough, it's not going to come past your mask and go on the box of Cheerios at the grocery store.
Good. Thank you, Doctor. Are there any questions from our media partners for the doctor before we move on?
This is Paul Nelson with 2 News. Obviously, the weather is very nice today. It's going to be nice this weekend. A lot of people are probably chomping at the bit to get outside and do some activities. What kind of advice do you have or recommendations for them if they do go outdoors?
Again, I'm not sure my expertise as a doctor is what's going to be answering that question. I would say, well, nothing where you throw a ball, because then someone else has to catch it. I don't think there's any recommendations to actually stay inside, but I know if you go outside, you've got to maintain a safe distance from anybody who didn't come out of your house with you. I probably would not pet other people's dogs. I probably would not get on a swing set. Again, the basic premises of fighting this virus are really the same. Even if you touch something, a swing set, a ball, a dog that has the coronavirus on it, as long as you wash your hands and don't touch your eyes, nose, or mouth afterwards, it would be hard to get the virus in that way. But I think that the social distancing has to take place outdoors. And the reason outdoors is obviously more dangerous is because, you know, somebody might ride by you on a bike and cough, and there's nothing you can do about that. So you're safer in your home or in your own, on your own balcony or backyard or whatever outdoor space you might have. But I would maybe defer to Kevin, Dick, and others in terms of the outdoor activity recommendations. I think, you know, no matter what, keep washing your hands, even if you didn't touch anything when you went outside. Come back inside and wash your hands and then wipe down the doorknob.
Very good. Thank you. Anything else for Dr. Wilson?
I've got another question. I don't know if it'd be for the doctor or Adam, if you could answer this, but looking at the models that we talked about on Wednesday, they look very different today. One of them had the April 19th peak on Wednesday. Today, it says that the peak already passed on April 7th, and there's going to be a lot fewer deaths. The other model has way fewer hospitalization projections too. What are your thoughts on the models and how much they're changing in such a short amount of time?
So we do have our health officer, Kevin Dick, on the line, and I'm going to defer to Kevin now. Kevin, why don't you jump in and provide us a response to that question and your update as well.
All right. Hopefully you can see me and hear me.
We can hear you now. Yes, sir. Thank you.
All right. Yes, thank you, Adam. So the projections that we have with the models are varying significantly, and so while the model that I believe is being referred to is the one that's coming out of Washington State, the IHME model, and that one is saying that we are now 2 days past our peak resource use for the state of Nevada. I would remind everybody that that's a state projection, and so it doesn't necessarily apply to us here in Washoe County specifically. But we also have other projections that are further out. The COVID Act Now projection that is specific for Washoe County has us at being at our hospital overload occurring on May 24th. So those are obviously significantly different. That model has also a statewide rate to it. I'm trying to get to that right now, or statewide projection, and the statewide projection for Nevada in that model is even further out to June 4th or so for the statewide for us hitting our maximum hospital utilization. So I think it's important to understand that these are different models and projections, and the results that you get are based on the data and assumptions that you put into that modeling software. And we're only really going to know when we've reached our peak and past it, when we look back at real data that we've collected over time. So I'm sorry I can't give you a more definitive information on what that day is going to be where we hit the peak. Everybody would love to know that, but we're only going to know it in retrospect after we've passed through that and look back at the data.
But
So,
the data is
so-
promising though, as of now, right?
Excuse me?
I mean, seeing the lower numbers, the data appears to be promising.
If it's correct, then that is promising, but we don't know whether that's correct or not until after we get through the peak. But I'll take encouragement and promising info wherever I can get it. With that, should I proceed with my update, Adam?
Yep, please do. Thank you.
All right. So today we're reporting 26 additional cases of COVID-19 in Washoe County and 3 additional recoveries. So that brings our total COVID cases to 389. And sadly, we had 2 additional deaths that we reported yesterday. Our total recoveries are 41 cases recovered. Our active cases are 338. Our hospitalizations are at 30 Washoe County residents hospitalized with COVID-19. Our hospitals, though, have plenty of capacity to provide health care for those in our community. As of April 8th, there were 58% of short-term acute care hospital beds that were occupied. There were 48% of our intensive care unit beds were occupied, and only 28% of ventilators that the hospitals have were in use. So plenty of healthcare capacity in our hospitals right now. We are operating our sample collection for testing, our drive-through post, we call it. We expect to collect about 200 samples today, and we'll be operating that again tomorrow. I guess I'd like to also mention that when we collect the tests and we get the results back from the Nevada State Lab, we then notify people that have tested positive. We also notify individuals that have tested negative. If somebody has not received their test results back, I would ask that they not call us until 3 days after the sample collection has occurred. We don't always get the results back right away. And we've had problems with our call center having lines tied up with people calling in for the results. So unless you've received a message from us and requested a call back, we request that the public wait for 3 days before inquiring about those test results. We're continuing to work with the hospitals on surge capacity, recognizing we don't know when we are going to be hitting our peak, but we do have these projections out there. And we're working with the Reno Sparks Convention Center and the Army Corps of Engineers, the federal FEMA, and our state DEM on setting up that as an alternative care site, and with a primary utilization being for a step down from the hospitals to be able to free up beds in the hospitals if we do have that surge and need that capacity there. We've had a number of concerns regarding short-term rentals, and we'll be providing a directive later today, formally through our JIC, but I can let everybody know now that I am directing the owners of short-term rentals in Washoe County to inform the people that will be using those rentals, if they are from out of the state of Nevada, that we are requiring them to remain in isolation at that residence, so self-quarantine for 14 days upon arrival, and that they should only leave the residence if it's an emergency. After that time period, those people remain subject to the governor's directive of staying at home and only leaving that short-term rental for essential needs. So we've been messaging since early March that if people have traveled out of state, we want them to self-isolate for 14 days. That's the incubation period to make sure they don't come down with COVID-19 from contacts that they've had in other areas that they've visited. And we're just re-emphasizing that this applies to the users of short-term rentals, and we're requiring the short-term rental property owners to inform guests that they have from out of state of those requirements. I'd like to wrap up with recognizing that we have Passover going on, and this is our Easter on Sunday, so beautiful Easter weekend that lies ahead of us. Wanted to echo some of the comments that the governor has made about the importance of not having large gatherings to celebrate this holiday. We all need to make sure that we are working to protect each other and our loved ones and to prevent the spread of this disease. And so I wanted to remind everybody of the importance of staying at home. I think Dr. Wilson addressed that very well, that your safest place is in your home, where you're not coming into contact with other people, that when you do go out, it be only for essential needs, and that you cover your face with cloth face covering to protect others from being infected by you, and to protect you from being infected from others that may have COVID-19 and may not have developed symptoms yet. And I thought her explanation of how to stay separated from others outdoors, how to avoid touching swing sets, playing with balls, those were all excellent recommendations. So please, everybody, have a wonderful Passover and Easter weekend. Our condolences to those that have lost loved ones in this tragedy. But everybody, please be safe and protect one another. So.
Thank you, Kevin. I do know there's some questions out there. I do want to get to our incident commanders real quick, provide a quick update on the alternative care site at the convention center. That's been a topic of discussion this week. So I'm going to turn that over to Deputy Incident Commander Scott Stevenson, who's with us. Good morning, Scott.
Good morning. Can you hear me?
We can. Thank you.
Good morning. The ACS branch is working closely with the Army Corps of Engineers. They did a walkthrough yesterday to finalize plans. The Army Corps of Engineers has been approved to, at least at our level here, do the build out at the convention center, which will free our branch folks up to shifting to the wraparound services such as laundry, food, showers, and all the other services that the employees and the patients, if there were to be any at that location, would need.
Okay, thank you. Any questions for Kevin Dick or Scott Stevenson from our media partners?
Hi, this is Bree Zender from KUNR.
Hi.
So is Washoe County having to compete with other counties for supplies like PPE or testing supplies?
Scott, would that be a question for you?
Yeah, I can answer that. We're competing with the whole world right now. We've got suppliers and equipment and supplies coming into this area from all over the world. So yeah, we're competing with not only the counties, the state, and basically the whole world globally.
I have another question. I know it's been reported from multiple media outlets about COVID-19 cases within assisted living facilities in the county. Has there been any widespread testing of the people who live in those facilities as well as staff?
So I'll take that one. This is Kevin Dick. And so the state licenses those facilities, and they have done testing in the facilities where they've been conducting outbreak investigations. We are expecting to have some additional test capabilities coming to us in the not too distant future for being able to collect samples and have additional individuals tested. And we are identifying healthcare and long-term care priorities for where we would try to work to do that sampling and to coordinate with the state for those facilities that they license in those efforts. So that's something that we're working with planning on right now based on our anticipation of having additional test collection kits available in the future.
Thanks.
That's your
Adam,
question,
this is
Ray?
Scott. I've got a
Go ahead.
supply chain.
No one's asked me. It's Phil Dentz, that Review Journal, Kevin. I just want to go back over what you were saying just a minute ago. So additional test kits, when they come in, they will be prioritized for testing in healthcare centers and assisted living and long-term care centers. Is that right?
That's our intention as we have increased capacity moving forward. We continue to test and prioritize based on people that have symptoms and vulnerable populations, and that includes also we prioritize healthcare workers and first responder personnel with that. But as we have more testing available, we'll expand that with prioritizing in those healthcare settings.
Okay, thank you.
Kevin, this is Riley Snyder from the Nevada Independent. Just wanted to ask, can you talk a little bit about what led to the decision to put out this directive for out-of-state people and short-term rentals, why you think that was necessary? If you have an estimate of how many out-of-state people are in short-term rentals right now in Washoe County, and then just to confirm that this is something that the state isn't ordering, this is something that's just Washoe County specific, right?
This is something that I'm directing for Washoe County. The governor has identified short-term rentals currently are identified as an essential business through the governor's directive. So what I'm clarifying is the requirement that if people have traveled from out of state and are in one of those short-term rentals here in Washoe County, I'm requiring the property owners to inform those guests at those properties of the requirement that they remain isolated for that 14-day period. That's consistent with what we've required for out-of-state travel since early March, and I believe it's also consistent with the governor's directive for people that have traveled out of state.
Hi, Kevin. This is On from KUNR. I have a question about self-isolation. Do health facilities and health workers have a different set of guidelines for self-isolation than the general population, specifically with regards to workers who have tested positive but are asymptomatic? I believe the CDC has different guidelines for health workers than the general population.
Yeah, thank you, On, for that clarification. The CDC does have other guidelines for healthcare workers that are really a critical need worker that differ from what I just described for people coming out of state. And so it's important to recognize that there is a different approach because of the need to maintain that healthcare workforce capacity.
And would that also include residential treatment facilities or nursing homes, or is that more for like hospital settings?
I believe it applies to all of the healthcare settings.
Thank you.
Adam, this is Scott Stevenson. I have a follow-up to my the question that I answered earlier with logistics.
Please. Thank you, Scott.
I wanted to clarify our incident management team, as well as the other incident management teams within the state of Nevada, are working closely with DEM to prioritize within the state where certain logistics are going. So clarifying what I said earlier, we're not really within Nevada. We are prioritizing that stuff through working with DEM closely to get where that stuff needs to be within Nevada.
Thank you. And that was Scott Stevenson, the Deputy Incident Commander for the Incident Management Team. Thank you, Scott. Any other questions for our Incident Management Team or the Health Officer?
Yeah, it's Phil Dentzer again, if I could jump in. Kevin, I'm just wondering, you're seeing more details on the data that's coming in. on the infections here. I'm wondering if there's anything that's jumping out at you that is different or alarming from what is kind of typically seen in areas in terms of who's been affected, anything that is somehow more of a unique concern to Washoe that you're paying more attention to?
You're breaking up a little bit, but I think I heard your question. So let me answer it and then follow up if I missed something. Is there something that's really that we're seeing in Washoe County that's really different from other areas? I'm not sure that there really is something that's much different that's occurring here. I think what's important for everybody to understand is that we do have people that are infected with COVID-19 throughout the entire age span. And so early on, the messaging was and continues to be that our elder population is at more risk from the disease. But I don't want anybody to think that they're not at risk of getting the disease, because we're seeing it occurring throughout the ages of our population. And so everybody should be careful. They can have poor health outcomes. We have seen cases of deaths occurring in people in middle age and young people. So and that they also can transmit the disease and harm other people if younger people get it. So I think that's what people should be aware of when you look at the cases that we have.
Okay, yeah, that pretty much covered it. Thank you.
Thanks.
Well, we're pushing afternoon, but got a few more minutes, I'm sure. If there's any follow-up questions, any final questions?
Hi, this is Lucia Starbuck from This Is Reno. I have a question for Kevin Dick, and I was wondering, what steps is the health district taking to be transparent, and how are you getting information out to the public right now, and how is it different than what you usually do?
Well, I'm conducting 3 of these briefings a week with the JIC, which is more than I'm usually doing. I'm trying to be available to provide information. We're doing a town hall meeting as well later today. We're putting out press releases with our Regional Information Center. So we're working to try to provide information and to keep the community up to date with what we're doing.
Thank you.
Thank you. Anything else? Okay.
Hey, Kevin, this is
none.
Brian Regan with the Gazette Journal.
Go ahead.
Hey, sorry. I was just wondering, will there be a racial breakdown of COVID cases out of Washoe County? I'm just curious.
I've asked our EPI team to work on how we can better present data that we have. I'm aware that there's more data that's being provided, breaking down different demographics and information in other areas. And I know we've been compared with Southern Nevada Health District. One of our issues is the limited resources that we have and not having some of the automated data systems that some of the larger cities' health departments have. So we're working to address that. I know there's a desire to have more of that information, and I'll be able to either provide that or provide you with more information on why we're not able to get that level of detail for you.
Thanks.
Good. Make sure I don't have any chats here. Nothing, no questions. Okay. Thank you, Riley, for your kind comment. If there's nothing else, we'll bid you a Good Friday. This is Good Friday, and a happy Easter. So we'll do this again on Monday at 11:30. Okay. Thank you all.